Welcome to the Cash Practice Solution, sponsored by Esprē Health. We are the Cash Practice Solution, here to support you and your team in building extraordinary relationships with your patients so you can have a practice that you love. We'll rescue your practice from endless insurance headaches and lead you to clinical and business success that exceeds your wildest expectations. It's time to run your practice instead of it running you. Welcome back to the Cash Practice Solution podcast. I'm Dr. J, and today we're dispelling a fear that's been a problem for most doctors dreaming about moving to cash practice, or DPC, meaning no third parties, no insurance. I'm just going to make it working with a patient and getting paid. Here's the question. What if I try this? What if I leave my safe, secure world and I fail at cash practice? I don't know. I don't like it, which doesn't happen, by the way. I mean, unless you hate medicine, and I've always hated it, you're going to love it. All right? So you're going to love it. Or I just can't make a living. I don't know that I've ever seen that happen. In fact, I know I've not seen it happen. Within 3 to 6 months, everybody is breaking even or doing better. So it's not a problem. But the question persists. So how can you be sure that you're not going to be that, 1 in 1,000 who actually doesn't make it? What if you do fail? How can you be sure you're heading in the right direction? What if you have a roadblock or questions? We're a pretty risk-averse bunch, doctors. I mean, we've been taught, about malpractice and the medical board and all the obstacles we have, and we're pretty careful. And understandably, you have a lot of fence sitters. So I'm going to give you some encouragement and show you on this podcast ways that you can be, as much as it's even possible, totally assured. Let's start with this. The sleeping giant of dissatisfied walk-away doctors and NPs just saying, I'm getting out of it. It sucks. I'm so tired of it. I can't do it. The giant is waking up and saying, wait a minute, I don't have to put up with this. The cash practice movement is gaining steam. I mean, it's a bulldozer. And docs and NPs are just getting out of the sick care third-party system in droves. There's a lot of retirement going on. I mean, that's definitely happening. We have some doctors we've worked with that they were almost there, and we turned them at the last minute, and they've been in practice now for 3 and 4 more years and enjoying it. It's diverting a lot of those retirements, and all by itself with new practices and doctors who are mid-career, they're saying, hey, you know what? I don't need to work in the ER. I can do a cash practice. I don't need to work in this primary care system. I can have a cash practice. It's hot. Just a problem. One problem. Cash practice is completely different than what we were trained to do. So you can't do it by yourself. You got to wear a lot of hats. You got to kind of be an accountant and a lawyer and a doctor and a lot of things. And that's a little scary. So what about technology and taxes and marketing? Well, when I was training back in the day, we had a fella on the floor, he's a 70-year-old guy with a diabetic foot and gangrene, and they tried all the antibiotics and didn't work, and he was going to have his foot cut off, and it was horrible. And at that time, we were residents, and our time was reimbursed at $16,000 a year, so it was just time. And I wasn't paying attention to the clock or the hourly, so I had days to work it out. And I went to the maker of Cipro, I think it was Bayer, and I went and got a compassionate use form, and I filled it all out. I sent it in, and sure enough, it got approved. We got the Cipro within a couple days. I mean, it was quick. It was pretty amazing. Saved his foot. Unbelievably cool clinical outcome, but a total business nightmare. I mean, it would be disaster to be unreimbursed for 2 whole days of work with great clinical outcome. You want great outcomes, but you got to get the other part right. So how do you avoid rookie mistakes? Get friends. Talk to people who've done it. And there's organizations and communities that are just amazing. I've had really good experience with this. Just my ability to talk to people and say, hey, what do you think? And they're willing to share. The DPC Alliance is a great resource. DPCalliance.org is one of the largest membership organizations for DPC physicians, offering tons of resources. I mean, there's so many podcasts and videos and conference material that you can, for free, can check out. And you don't have to make mistakes on stuff that's available to you. And in your part of your time, you can study it and find out, is it really for you? And it doesn't cost a thing. There's a doc, her name's Marielle Conception, and she and I had a conversation, and she straightened me out on some things I didn't understand. Like I thought I'm a fee for service, so I'm not a real DPC. And she goes, oh no, by law, you're DPC. And we talked about it. She's great. She has guests on all the time, and she's got great information at her website, the DPC Alliance. They have an annual meeting that's really great, and you can kind of kibitz with people and get with them and figure out, location and stuff like that with doctors who actually have experience doing this, and they're passionate. I mean, it reminds me of when we were in medical school and boy, I'm going to be a doctor, and so excited. I mean, it's like a rebirth of that. There's another group called the DPC Frontier, and that's at dpcfrontier.com, and they have a lot of regulatory stuff. The Alliance has a lot more practical practice stuff. This is much more in the regulatory world. They have a map of DPC practices of the whole country, and you can see the density of different places, which I'll explain to you in a minute why that's so important. And it helps you kind of look at competition, and also potentially you could find mentors, people who are in your area who they could use a little help with coverage, or you could help them with sharing supplies. We do it all the time. But the site also links to academic publications. So you have really good information that you can rely on. Policy papers and all sorts of open access recordings that are about DPC. And then I've done some work looking into books and paywall articles. I wouldn't bother. Don't spend your money on that. You don't need to. You've got free resources that are excellent. You've got this podcast, which, I mean, we have a ton of material to share with you that's really, really good, for free, and you don't have to pay any money. That's one of the things with DPC that's so good is you can start slow and don't pay a lot of money, don't get a lot of debt, and you can get really far with just the available resources because of the community that's involved, people who are really excited about it. This episode is brought to you by Esprē Health, the game-changing platform for cash practices that are ready to level up. With smart, intuitive AI tools that sharpen your clinical insight and streamline your business, Esprē Health helps you run a practice that's not just efficient, it's enjoyable. So if you're ready to break up with that cranky old EMR and finally experience tech that makes your life easier, come on over to EsprēHealth.com and see how thoughtful technology can transform your practice. And hey, don't forget to subscribe so you never miss an episode that delivers the freedom to choose and the power to heal. Now, let's get back to the show. So what are the top 4 mistakes? What are the most significant struggles for new DPC clinics? Location, location, location. Everybody knows that. Real estate people, I mean, that's the whole thing. When you buy a building, when you rent a building, location is everything, right? So if you launch in a community that's never been exposed to DPC, it's going to be a little bit harder. If you launch in a community that doesn't have anybody that's capable of paying cash for the care, it's going to be harder. I almost might put it in the impossible category. So you got to be careful about location. I think that's number 1. You don't want to start out on the wrong foot. And a really great way to avoid that is to look at the DPC mapper on the Frontier site. And you'll see where, if you see a lot of DPC practices, it means that that's probably a good area. You know that Burger King used to open up right across from McDonald's because they saw all the work they'd done on location. McDonald's had spent $500,000 figuring out where the best site was. Burger King had just opened up across the street and saved the $500,000. You can do the same with the DPC mapper. Makes great sense. So just location, that's number 1. Number 2, and this is also a hard one for some people to swallow. It took me, I think, almost 5 years to say yes to this. The doctor is the brand. I'm Dr. J, the host of your DPC podcast, Cash Practice Solution, right? So how hard is that to say? It's easy, but to get started was tough. Now that I'm there, people know me. They stop me in the grocery store. They stop me and say, hey, Dr. J, I am the brand. A DPC without that is just another doc in the box. I mean, you have to be willing to say, you are the practice. You as an individual are the practice. You may get a few docs, and each of them can have their own brand, and that's great. We have one doc that we work with. She's a nurse practitioner, but she's excellent. And she's beautiful, she's bright, she's talented, she's got everything going for her, but she was really afraid to put herself out there and be visible. And I told her, you're a rock star. You should do this. And Once she did it, once she embraced it, it blew her up. She did so well because people want to be with someone they can identify as the one who's taking care of them. So get over being concerned about narcissism and promote yourself. It's okay. You're allowed. You've worked really hard to be good at what you do. You should just make yourself available to people. Number 3, not having anybody you can talk to, having no backup and trying to make this happen. Boy, it's tough. Make a few friends. Develop some relationships. You can do that at the Frontier, at the Alliance. You can talk to us. It's not hard. If you look at the resources that are available, you'll find lots of doctors who are absolutely open to having conversations. On the Doximity app, I see tons of that where, hey, and by the way, if you're interested in a DPC practice, private message me. We can talk about it. It's available. You don't have to pay $5,000 a month or $10,000 a month consultant for that. It's unnecessary. So your solution, find at least one mentor. Find somebody who you can talk to. Finally, and I think this is probably where people, this is the final obstacle, is money. They don't understand the actual startup costs and how that works. It can be incredibly inexpensive to start a practice. You don't have to have a beautiful 3,000 square foot building with 7 exam rooms, and you can start with an exam table, a folding massage table, an otoscope, an ophthalmoscope you get off of eBay, a blood pressure cuff from Amazon, and a stethoscope you've had since the beginning of your career, and do a great job. The whole thing, it's the relationship with a patient. If you can get that right, all the other stuff falls into place. It's so hard to imagine how it would be if the relationship had been elevated from the beginning of our training, and you could really see how it drives marketing, it drives your outcomes. When patients trust you, they're healthier. They listen better, they respond better, you enjoy it better, everything works better. So don't spend a lot of money to try to make it work. Spend your time and spend your energy on building relationships, and just do a great job for your patients. Make a phone call, look stuff up, engage. It's going to make all the difference. Keep your overhead low, buy used equipment, use those DPC resources. So when your relationship with your patients is really strong, they'll pull for you to succeed. They'll tell everybody about you. They'll say, oh my gosh, she's beautiful, she's amazing, he's great. And they'll use your brand. They'll say Dr. J or whomever else. The DPC model creates a completely different chemistry than the detached third-party model, which basically, who's taking my insurance this year? Next. It completely eliminates the bond between the patient and the caregiver. I've got patients in our practice I've been seeing for 20 years, and they still send friends and relatives, and we spend a lot of time saying no. So, it's a good problem to have. So if you're still on the fence, take me up on some of the resources we've mentioned and give it some thought. I think it's a wave that you're not going to be able to avoid. You might as well get on the wave and go. And if you've decided already to start a DPC, make a plan to meet your goals with the help of patients, friends, and providers who've spent some time in the trenches, like me and some others. Plan to share the lessons you're learning and help build back a real health care system that we care about people's health. And it's not just about trying to survive. And you can get there. So for more, follow us on your favorite platform or look us up at thecashpracticesolution.com. Thanks for joining us on the Cash Practice Solution, sponsored by Esprē Health. But before signing off, I want to remind you of our keys to lasting success. Listen to your patients, learn their stories, love them with all your heart, and you will be unstoppable.
Thanks for joining us. And if you have enjoyed today's conversation, be sure to hit subscribe so you don't miss out on future episodes packed with insights to help your cash-based practice thrive. And don't forget to check out all the tools and resources available at cashpracticesolution.com. They're free to you, and we're always adding more. Keep raising the bar in patient care. We'll reconnect in the next episode with more ways to help you succeed.